A full arch reconstruction done, and you now don't have any clue about what's happening. And what you need to know is, before you go into this and before you go into these consults, is there's this concept we call in dentistry of an FP1 or fixed pros 1 and an FP3 or fixed pros 3. And all that really means, and it relates to, is what am I replacing for the patient? Now, an FP1 style prosthetic, which is how I choose to do every single case I possibly can, is preservation of bone, preservation of gum tissue, and replacement of only teeth. Now, if you get in down to the road and you have really bad periodontal problems and you have some bone loss problems, sometimes you end up having to replace some gum tissue to mimic the missing bone in the cases. But I would say in my practice, over 90% of my cases are done with just tooth replacement cases. Now, why is this important? Well, one is that some practices do it only one way, because it's a nice logarithm. Their lab work's the same, everything's the same. And if, for instance, they're accustomed to doing a FP3 or a tooth and gum style restoration, they have to make space for that. And if you have to make space for that, if you take my buddy here and you look at him and his teeth, a typical reduction for space to make that kind of deal looks like this. And I don't know if you can see that good if it's focused. It's a big hole, and it's bone. It's a lot of bone removal and tooth. And that is done so that you can make a prosthetic that essentially looks like this. You can replace part of the gum tissue and part of the teeth. And what that allows you to do is it allows you to hide this junction up under the lip, and all you see is this fake gum tissue in this. It's really easy. You have a lot of control. It's a one-piece prosthetic, so you can do it with just 4 implants. Tends to be, in my practice, the cheapest way to do it. Now, how do I prefer to do it? Well, I prefer to make a prosthetic for patients that looks more like this. If you can see that. I don't know if that'll focus for me, but that's small. And in order to do that, I have to preserve all of this bone and this gum tissue and create contours so that this prosthetic will sit very nicely like so. Now, you can imagine when that goes into your mouth and you only have tooth replacement and you have natural gum tissue and you have nothing covering the palate or covering anywhere, your comfort level goes way up. Worst case scenario is if they really get aggressive and a lot of bone is either has to be removed or is chosen to be removed, you can end up with a prosthetic that looks like this. This is, to me, basically a denture. And it's a denture that uses some implants to attach in place, and that's what your prosthetic looks like. Now, if you ask me, in my experience, patient satisfaction goes way up here with the single tooth prosthetic, and patient satisfaction starts going way down the more gum tissue I add. So when you go into your offices, I'm not going to lie, it takes more skill to replace no gum tissue. You have to sculpt bone, you have to preserve bone, you have to graft bone, you may even have to graft and preserve tissue to do this. It's a more complicated procedure, and that is usually why somebody elects to just do it the other way and remove the bone and replace gum tissue and tooth. So there you go. There's kind of a little overview of prosthetics. So this is a denture, okay? Everybody knows what a denture is. And this particular denture has 4 implants under it. Boom, there. Implant prosthetics are not easy for somebody who is trying to navigate the waters and figure out what it is they want to do for themselves. This, as you can probably guess, looks like a denture. The palate's covered. There's a big flange, acrylic flange that covers the ridge. And in this particular case, it's held in by 4 implants. It's very stable, it's very nice, but it covers the palate and it will affect your taste. It's going to feel like a big clunky thing in your mouth. As implant prosthetics kind of evolve, This is the next best thing to a denture. This is an implant retained prosthetic that sits on a flattened portion of the patient's ridge or the bone and attaches with implants and goes in like so. Now, the nice thing about this is there's no palatal coverage. You don't lose taste. It doesn't feel as clunky. But what you may not know, what is also possible, even in full mouth restorations, is something called an FP1 restoration, which is just replacing teeth. So these particular teeth here are attached via those two implants. And on the model, whether you can see or not, the gum tissue is sculpted and worked with so that as the prosthetic goes in, it fits with the existing gum tissue. It's a stark difference in having something like this in your mouth. This is going to feel clunky. This is big. This requires bone removal. This is not clunky. This is small. This is comfortable, hygienic, and requires bone preserving techniques. So if you're going to get an implant prosthetic done or you're having a restoration, you should know what's available and what your particular office is going to target for your final prosthetic result. So very important.